Hello. And welcome back to Motivation and Asiya with Nafeesa Dangor, where we're inspiring you to do a little bit of everything, of course, during this lockdown and Ramadan. And one of the important things that also affects us is our health, and not just during the Ramadan period, but of course, I think the lockdown's just edging everything on. And today I have with me on Medical Perspective Dr. Mohammed Moti. Assalamu alaikum wa rahmatullahi wa barakatuh.
Walaikum salam. Good to be here again.
Yeah, thank you for joining me once again on the show.
I'm happy to be a part of it.
Doc, last week we spoke about flus and colds and what we can do about it. But I think coming to the change of season also, a lot of people are suffering from sinuses, which is something they never had before. And we wanted to know, how do you go about dealing with it? Because sometimes people think they have a cold, but it's actually a sinus issue.
Yeah. So sinuses, I mean, you said that some people will maybe not have had it before, but I'll tell you one thing. I think anyone who has sinus problems knows exactly about it because they experience issues related to their sinuses on an annual basis and possibly even longer than that. It's a very, very difficult illness to deal with. So basically, let's start. What are your sinuses? So basically, sinuses are these hollowed out areas in parts of your skulls. We have two big ones over here in your cheeks. You have them just between your eyes over here, and then you have them behind your nose and behind the eyes as well. And basically what these are, it's a cavity in your skull, and there are a lot of different functions that they have. And I think why so many functions have been described is because scientists don't actually know why we have them. So, I mean, one of the things is that people suggest is that inside the sinuses, it's lined with a mucus layer. So a layer that produces sort of something similar to saliva. And we have that sort of mucus in these sinuses, lining these sinuses. And what they suggest that they do is they help to humidify the air that enters into through our noses or our mouths while we're breathing. Another thing is that this mucus is then drained through the nose. So that's how we get our snot, essentially. What that does is it helps to trap bacteria and dust and all of those kinds of things from getting into our system, further into our system. And so it's a protection against all of these bacteria and dust particles. And so sinusitis is basically when one of those or more of those cavities get infected, and it can cause inflammation. And it's a very, very uncomfortable feeling. A lot of people do experience it, and they can get severe headaches. They can feel blocked up, congested, and they can also have things like a running nose, post-nasal drip. And so the thing is that it's not necessarily something that always requires you to see your doctor. But if you're not sure if it's something to do with a cold or a flu, or if it's a sinus infection, then it's a good idea to go and visit your doctor and see. And basically what they look for signs of any infection. And, they'll see if there is a bacterial component to it or not. But people who suffer from sinusitis, a lot of the time, as you mentioned, we're going into a change of season period. It can be triggered by so many different things. So it's not always just an infection. It can also be because of things that are like they are allergic to, dust, pollen, even fumes from certain agents that they're quite sensitive to. So it's a complicated thing, and it's the biggest thing is that it sometimes can be difficult to treat as well. So you get two different types essentially.
Suffering from sinuses, and I know I'm one of them.
Yeah.
That's why I
Yeah.
brought up the topic. Is then you find I can't even walk where I am because I'm tearing one way. So
Yeah.
you find in a situation where you're so congested. How does one deal with that?
So I suppose, well, you see, I was just saying there are sort of different types. There's an acute sinusitis and a chronic sinusitis. Okay, so an acute episode is something that lasts anywhere from until about 4 weeks.
Mhm.
All right. And then a chronic sinusitis is something that lasts longer than 3 months. And then the in-between phase, which is, I suppose 4 weeks to 3 months in between there, if it lasts for anything between there, we don't have a name for it, but we'd call it, I suppose, acute on chronic. But that's the big difference. And a lot of the time, the causes for them can be something that are different. So an acute sinusitis that's going to last less than 4 weeks, a lot of the time it can be accompanied by a cold or a flu or a respiratory tract infection. So the management of that would be to treat the infection. So whether that means getting an antibiotic and also some symptomatic relief. And so because that is always accompanied by another infection, then the other infection is our primary goal at sorting that out. And hopefully, as that resolves, the sinusitis also resolves. But then when you have a chronic sinusitis situation, then it's sort of as a result of something different. So not usually an infective process. And that's where we have it a lot of the time in change of season, where people are sort of allergic to something, or there's a lot of dust in the atmosphere, or sometimes people even with things like a deviated septum can also get sinusitis. So in an acute setting, we're targeting the illness and we're treating the sinuses as a symptomatic relief. And there we can use things like steroid sprays for that short period of time. Sometimes we can also use antihistamines that can sometimes cause a little bit of relief. But in an acute setting, we are targeting the illness that's accompanying it. In a chronic setting, then we are looking at what is causing this. So again, we can use some of the treatment does overlap. So a steroid nasal spray is very helpful for a lot of people for a certain amount of time. Antihistamines are very useful, and we can use these especially when it becomes a sort of seasonal thing. So you get it a lot of the time now around April, May, and then again also around August and September. That's when people get, and that is a lot of the time because of the pollen that's in the air or the dust that's in the air. So in that situation, antihistamines are very helpful, and we try to give obviously something that's not going to make people too drowsy, a dose every morning and also in the evening as well. Those are some of the things that you can do. And then, of course, there are also a whole lot of things on the market about sinus drainage situations, sort of like a douche or a sinus pot, where you essentially pouring saline fluid into one nostril, tilting your head, and it's hopefully coming out the other. And that's sort of a way of flushing out the sinuses, helping to get rid of some of that clogged up mucus, and giving you some sort of a relief. And obviously, when the cause is maybe something of like a polyp, which is a growth that people can get in their nose, or a deviated septum, those become a little bit more complicated, and those often need surgical intervention.
Right. Does your diet affect it also? Because I mean, I know a lot of the times if you have a sinus issue and certain things that you eat, will that actually edge it on?
It can, and but it's also very specific to the individual. So a lot of the time, what we can see is dairy products seem to can worsen the situation or trigger the situation. So that's one that people, we we don't want them to necessarily adjust their lives completely. So we don't say to stay away from them completely, but to cut down when you are having a sinus issue. With dairy products is definitely one of them, but also it can be other food products, and it's almost as if it's sort of like a food allergy. And so allergens in your diet that you are perhaps sensitive to, things that and that's a very specific thing. It's hard for me to say, but it seems that dairy products on the whole, especially certain types of cheeses, tend to be a trigger for a lot of people. But again, that's something that you have to deal with on an individual basis.
Would you advise people that probably, as you were saying, have certain allergens and they then have a sinus attack, is try and maybe reduce having those particular allergens, for example, dairy products?
Definitely, it can be very helpful. A lot of the time with food allergens, you tend to get more abdominal effects. So that's sort of like your IBS or irritable bowel syndrome symptoms. So it's not always it doesn't always affect your sinuses. But if you feel that, I mean, if there is something of that, we always tell people to try it, to cut down for a few days, see if it makes any difference. If it's not making much of a difference by leaving that out of your diet, then it's probably not going to help in the future. But if it is something that you can notice in yourself that does help, staying away from, for example, dairy products prevents your sinuses from acting up so much, then definitely we encourage it.
Right, definitely. And one quick message before we leave. Unfortunately, we always seem to be running out of time.
Yeah. Well, I mean, look, just to everyone out there, keep looking after yourselves, staying indoors, staying safe, wearing these mandatory masks at the time that we required to do so under level 4. And by wearing those masks, you'll hopefully be combating a lot of other ailments, including sinus related issues, because there'll be a reduced amount of dust and pollen coming into your system.
Jazakallah for your time, and we look forward to talking to you again next week.
Perfect.
And you
Sounds good.
stay
Keep
safe
well.
as well.
Thanks very much. Assalamu alaikum.
Okay. Walaikum salam wa rahmatullahi wa barakatuh. And that was Dr. Moti, definitely always inspiring us with some form of medic information. But my closing monologue for today is we seem to be running out of time. Is what counts in life is not the mere fact that we have lived. It is what difference we have made to the lives of others that will determine the significance of the life we lead forward. And that was written by Nelson Mandela. So, myself and the Salam Media team, we wish you a lovely day going forward, and we'll see you same time tomorrow. Assalamu alaikum wa rahmatullahi wa barakatuh.